Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our cancer awareness series, we have Dr. Ashwin Tamhankar with us. Dr. Ashwin Tamhankar is a dedicated urological cancer surgeon and a robotic surgeon in Navi Mumbai and is currently practicing in Apollo Hospital, Mumbai. For the past 8 years, he has worked in this field. Welcome to Medicircle, Dr. Ashwin Tamhankar.
Thank you so much. Thank you for having me here.
So, as cancer cases in India increased at an average annual rate of 1.1 to 2% from 2010 till 2019, and according to the new report, deaths from cancer in the country also went up at an average rate of 0.1 to 1%. So, doctor, can you tell us what is prostate cancer and its symptoms, causes, and treatment?
Sure. So as you rightly mentioned, it's a dedicated field called urological cancer surgery. So we look into 5 organs and their cancer management, which includes cancers of kidney, urinary bladder, prostate, male genital organs, penile and testicular cancer, and adrenal gland. So it's a limited and a dedicated niche area of expertise and a focus which we have. So talking about the prostate cancer, one of the most important cancers across the globe now, because it is more versatile and a lot of literature has been evolved over a period of last few years on prostate cancer. To talk about these statistics for making people aware, it's a second most common cancer in a man, second most common cancer. Unfortunately, and it exactly to speak about percentages, 14.6% for lung cancers and 14.3% for prostate cancer across all men in globe. Unfortunately, in India, we do not have a robust awareness of this particular cancer, and that's why we are here for. Across the globe, nearly 1.3 million patients get diagnosed with prostate cancer every year, and nearly 3.5 lakh people unfortunately succumb to this cancer every year, which is a very harsh reality. In US, if you say take a statistics of about 2020, nearly one person is diagnosed with prostate cancer every 2.7 minutes, and one person dies of prostate cancer every 60 minutes approximately in US. So which is a very alarming number. We should be all taking this with a very much attention, and making most important thing is to create awareness around this. Well, another important aspect is it is a screen detectable cancer. Before that, I'll just say what screening means. All of us know for breast cancers, they do mammograms. For cervical cancers, they do pap smears in females. Likewise, in males, the important cancer which is detected out of screening is prostate cancer. So screening essentially is a very simple test which will help us to, which will be applied on a general healthy population, on a mass population group, and which will pick up early cancers by virtue of having good sensitivity. And that test should be obviously cost effective also. So this particular cancer is a screen detected cancer. The initial screening test involves only 2 simple tests. One is a physical examination of a prostate done by an expert, that is urological cancer surgeon, and secondly PSA test, which is a simple blood test. Results are available within 4 to 5 hours. Anything which is abnormal eventually percolates into the further diagnosis of prostate cancer by doing biopsy and MRI, and depending upon the situation, we take it forward. But screening ideally is a standard norm. If you compare or if you understand what happens in the Western countries, so American people will start screening for all men beyond the age of 55 year, and it is once a year. European and UK people will be doing this screening from the age of 50 years onwards. This particular test, one per year for every man staying in the globe, is important. India, we do not have this concept very much populated across the masses, and which is a very sad reality, and that's why we get a lot of patients in the late spectrum of the diagnosis. If you can understand, if we diagnose a cancer early, we pick up the cancer early, we can treat it with the intention of cure. And unfortunately, if you do not diagnose it in early stage, we land up into a late phase of diagnosis, and then we may not be able to potentially cure the patient. So most importantly, screening is helpful for getting detected with this particular cancer at an early stage. The management of a prostate cancer, I will just say one line out of it, is when we detect cancers early, we have treatment intentions aiming towards cure, in which a robotic surgery for prostate cancer is a very much important thing, and radiation is another parallel modality of treatment that will be discussed out with the patient in details. Let's not go into details of it now. So prostate cancer, as we discussed earlier, the symptoms predominantly will not be presenting because of the virtue of having a cancer. It's because of the enlargement of the prostate. So prostate enlargement happens for every man after certain age group, after say 40s and 50s, and on that enlargement we have cancer development. So because of cancer, there will not be any symptoms, but general symptoms of these prostatic enlargement and possible cancer development is urinary problems in terms of having nighttime urination, daytime frequency, urgency of urination, or poor stream in the urination.
Okay, doctor. So, can you tell us about what is kidney cancer, some of its symptoms, causes, and what is the treatment for it?
Absolutely. So kidneys are the filtration units in the human body. There are two kidneys, one on the right, one on the left. Tumor development in the kidney will be cancerous. There are general risk factors which are defined in terms of, most importantly, smoking, obesity, and high blood pressure, long standing. So these are the three risk factors for kidney cancers. Predominant symptoms of kidney cancer would be in early stage. Again, it will not throw any symptom, but as the size increases, as the stage becomes little advanced, it will throw a symptom in terms of having blood in the urine, that is called as hematuria, or pain in the flanks on the backside near next to the spine. So these are the symptoms of kidney cancer, and in the late stage, when it goes to the bones, it will manifest with bony pains or something of similar sort. In India, we are having some different statistics as compared to the Western countries. Average age of kidney cancer development in the globe is 64. In India, we are at 55. That means we are nearly 10 years or a decade earlier. So we are a little younger for the diagnosis. 4:1 is the predominance between males to females. So more males getting diagnosed. Another important factor is only 10% of the patients are diagnosed in a small stage of up to 4 centimeter tumor. Majority are diagnosed with a little largish size tumor, and nearly approximately less than 30% individuals, or approximately 30%, one third of the individuals are of the age group less than 50 years also. So these are the important things of kidney cancer. Kidney cancer, like I said, it's generally a very much important cancer for the urological armamentarium. We have a lot of incidents in India. These days we get a lot of younger patients, as I mentioned earlier. So most important is to have regular health checkups, because as in the early small stage of the tumor, you may not be able to see a symptom or present with a symptom. So it is always reasonable to have regular sonographies done as a part of health checkups on regular occasions, which are generally included as a standard of norm in majority of the health checkup packages these days. So these tumors are detected with these sonographies in an early stage. The management of a kidney cancer would essentially revolve, it's more of a surgical tumor. In the early stages, operating the kidney is an important curative modality, but goal is to have detection in early stage so that we do not need to remove the entire kidney. We just remove the tumor and as part of a kidney and try and spare the kidney on that particular side. That is called as partial nephrectomy. And when the size is little larger, we have to remove the entire kidney. That is called as radical nephrectomy. Both these surgeries can be done in a conventional open manner, or a robotic manner, or a laparoscopic manner.
Okay, doctor. So, can you tell us about what is bladder cancer, its causes, symptoms, and what is the treatment for it?
Right. So urinary bladder. So kidneys will drain urine into the urinary reservoir called as urinary bladder. So urinary bladder, any cancer development is in the bladder will be called as urinary bladder cancer. It's generally a 7th most common cancer in a man, and about 10 to 11th most common cancer in females across the globe. Predominant symptom of bladder cancer is blood in the urination. So any single episode of blood in the urine should not be ignored, please. So that is one important awareness message which we are trying to convey today. It can be because of bladder cancer or kidney cancer, or a rare situation of prostate cancer. So single episode of even blood in the urine is abnormal. Please do not ignore and report to the doctor. Bladder cancer, again, smoking is a very important risk factor for bladder cancer, and industrial exposure of chemicals in petrochemical industries, rubber, dye industries, chemical industries are the leading causes of bladder cancer, because these chemicals are inhaled and they are excreted into the bloodstream and then finally come into the urine, and in the bladder they have a longer tendency to stay in the bladder, as it is a reservoir, and hence the cancer development happens in the bladder. Management of a bladder cancer would be divided into early stage of non-muscle invasive and late stage of muscle invasive cancer. Both modalities, both aspects will be dealt with surgically predominantly, and addition of a chemotherapy or a radiation therapy will be required as per the indications.
So, Doctor, on Medicircle, our main focus have always been to provide the audience with large amount of information in less time. And so, for today, we are going to conduct a small question answer session in which you can either answer in yes or no, or a one or two line sentence answer will also do. So, Doctor, my first question is that do only elderly men get prostate cancer?
So not a standard norm, but predominant age group will be beyond 50 to 55 years. But these days we get a lot of patients at younger age also. So I will say be vigilant, do the screening PSA testings and examinations starting from the age of 50 years, one per year. Every man should be doing it.
And does kidney cancer primarily affect the young people?
Yeah. So kidney cancers, like I said in the previous talk, kidney cancers, we are at about 10 years younger in the age of onset in India as compared to the Western countries. So we have average age of onset as 55 years in India. So a lot of younger patients getting detected with kidney cancers because of the environmental stimuli or the smoking as a risk factor. So important is to have good health checkups on regular occasions in terms of sonographies done regular intervals.
So, do all bladder cancer are caused by smoking?
So generally speaking, not all, but about 50% of the bladder cancers are related to the smoking. And amongst the smokers, bladder cancer is one of the commonest cancers. Obviously, smoking will have other implications or other cancer developments as well. But one of the important cancer developed in a smoker patient or a smoker individual is bladder cancer. I'll just quickly mention about what is pack years. So generally, when someone consumes one pack a day, that is approximately 10 cigarettes a day, that is, and for say 10 years, then the individual's risk calculated is called as 10 pack years, meaning one pack a day into number of years will be the total pack years of cigarette consumption. So higher the pack years, higher is the risk of cancer development in general, not just for bladder but other cancers also, head and neck cancers, lung cancers, esophageal cancers, colorectal cancer. So all these cancers are related to the smoking. More important is once you stop smoking, another very important message, that the day you decide to quit smoking, from that for your risk to become normal, it takes 10 to 15 years. So if you are inclined to get that risk as less as possible, try and do it today, so that after 10 to 15 years you will have results out of it. So most important is recently Close the Care Gap was the initiative taken by UICC, the body which runs the cancer institutes. So in this particular situation, most important pillar of closing the care gap is to create good awareness of the cancers, as we did in this particular session today. Be aware of risk factors, be aware of symptoms, try and quit the risk factors, that is called as primary prevention. Report your symptoms early or get the diagnosis early for better prognostication or better treatment, that is called as secondary prevention. So these are the essential pillars of cancer, creating a robust infrastructure for cancer development or cancer management.
Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you so much.
Thank you.